So good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourselves, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Reminder, after the pep talk, please take the online learning curve evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this shown here. The link has been placed in the chat box by Abet. Another reminder, obtaining 50 OLETE certificates will entitle one mentee, a mentee to a voucher for a ROJoson telemedical consultation like this. This is our 127th pep talk. So strictly speaking, all mentees will have the opportunity to get at least 3 voucher if they get or at least 2 voucher if they get 100 OLETE certificates. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking first before we start the pep talk proper in 2 minutes. Please show your faces in the video. We start. 1, 1, 2. Okay. No problem, Manette. Okay. 1, 2. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control of the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. Actually, by May 5, 2024, that's about 5 months from now, we will be completing our 3rd year of pep talk. My pep talk today is entitled Beware of New Year Eve's Health Dangers. The empowerment objective is for the lay people to have an essential understanding of the New Year Eve's health dangers in their health management. So may mga danger din sa during the New Year Eve. No? The contents of the pep talk will be the following. Of course, let's start with the definition of a New Year's Eve, common health dangers during New Year Eve celebration, prevention of those common health dangers, then prevention of vehicular accident, which is one of the more common health danger, which is usually related to alcohol intoxication, prevention of physical injuries from quarrels and disagreements, okay, again, usually related to alcohol intoxication, and then prevention of heart syndrome or heart attack, prevention of firecracker injuries in the Philippines, first aid management of firecracker injuries, prevention of burn injuries, and first aid management of burn injuries. So these are the common health dangers that I will be discussing. Of course, there are some more, okay, which we can discuss later on. As a disclaimer, my pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from personal experience as well as from experiences from other health professionals. Let's start with the definition of New Year's Eve. So New Year's Eve is the night of December 31 and the morning of January 1. In the New Year's Eve, many people celebrate the end of a previous year. So this year we'll be celebrating 2023 and the beginning of a new year in various countless ways. So beginning of a new year, which is 2024. These celebrations, if not done with caution, properly, if not done properly, with the health dangers in mind, usually lead to various health dangers which are usually preventable. Yan ang ina-avoid natin. The common health dangers during New Year's Eve celebration, which I have identified. So in the Philippines, the common health dangers will be the following: vehicular accidents, which is usually related to alcohol intoxication, physical injuries sa mga Hawaiian, no? And then disagreements, no? Again, rising from drinking alcohol. Of course, may personality component din yun. And then heart syndrome or heart attack and firecracker injuries. I'll just tackle these four, but I think there are some more. Example will be eating too much can cause gastroenteritis or dyspepsia, etc. The best way to prevent the common health dangers during New Year's Eve celebration is to know what they are. So be aware of what they are, and then be aware of their usual causes. And then after that, you must be able to know how to prevent, and then you must have the resolution to prevent it. So let's start with the vehicular accident. As I said, this is usually a result of alcoholic intoxication. Drinking alcohol in moderation, or better still, abstain from alcohol, is a way of prevention of alcoholic intoxication. And then when you're intoxicated, don't drive. Okay, don't drive after drinking alcohol. So be aware of this danger. Okay, vehicular accidents secondary to alcohol intake. It's as simple as that. So do not drink as much as possible, but if you have to drink, drink in moderation. Okay, then if you drink kahit na little amount, no, just avoid driving. Okay. Then how about physical injuries? Marami tayo nakikita yung minsan nagpapatayan yung mga saksakan, barel, because of the quarrels and disagreements, which are usually an offshoot of nakainom, lasing, no? Okay. So again, try to avoid alcoholic intoxication as a way of prevention. Then don't quarrel after drinking alcohol. Mahirap yata i-control yan. But just make sure that you don't quarrel with anybody. Tahimik ka na lang. Don't inflict injuries. Pag may disagreement, do not inflict injuries. Okay? Because you might regret it. So you end up with the charge of homicide. Okay? Attempted homicide. Now, the third is prevention of heart syndrome and heart attack. I don't think all of us, many of us are aware of that, but it's common, no? Okay. Because in the 2018, that's quite recent, okay, a study has shown that the risk of heart attacks increased significantly during the winter holiday season. So wala tayong winter, but usually mataas din ang incidence natin during this time because the root cause will be the same. So in this study, during a 15-year period, so this is done by the Swedish researchers, okay, they discovered the chance of a heart attack was 15% higher than usual on Christmas Eve. So Christmas Eve, mataas na. Then 37 higher on Christmas, yung 15% sa Christmas, 37 sa Christmas Eve sa gabi, and then 20% higher on New Year's Eve. So nakita nila itong mga trending, no? So nagtataka sila bakit ganon, no? So this is quite recent, no? So what is the so-called holiday heart syndrome? So They coin it holiday heart syndrome because nakikita nila yung mataas ang incidence sa mga heart syndrome, heart problem, heart attack, no, during the holidays. So holiday heart syndrome occurs when patients develop an abnormal heart rhythm called atrial fibrillation or AFib. No? AFib, yung tibok ng puso, hindi siya regular. No? Okay. Kadalasan mabilis, no? Fibrillation mabilis, at hindi yung dug, 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 kung saan, dug, 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 no? Ganon, no? So it's a rhythm disorder of the upper chamber of the heart, during which time the upper chambers lose the mechanical function and does not contract. So hindi siya synchronized sa baba. Kasi yung sa heart, merong atrium, may ventricle. Hindi na synchronized, no? Okay. And then what causes this AFib or holiday heart syndrome? Doctors coined the term after noticing an increase in the instances of this condition related or caused by drinking. Yan ang napansin nila. Mataas ang correlation with excessive holiday drinking. So alcohol can trigger episodes of AFib or an irregular heartbeat. So it is also important that holiday heart syndrome is one specific condition linked to heavy drinking. So tandaan natin, aside from yung intoxication causing vehicular accident, or eventually, pag palagi umiinom, mga fatty liver, no, and other health causes like cancer, gano'n, no? So we must take note that yung mga excessive alcoholic drinking, especially during the vacation, no, can also cause heart problem. So, but this is not the only cause for the excessive drinking. There are other, this is not the only factors that will lead to that AFib. No? So the other causes for the irregular heartbeat will be emotional stress. Pag sobrang depressed o ganon, no? Okay. So unfortunately, the holiday season can be a source of stress due to family gatherings and financial pressure. So hindi yung porque may bakasyon tayo, everything is fine, masaya. Kadalasan may mga stress din, no? Okay. So especially may financial pressure, okay? And then overindulgence, meaning sobrang dami sa pagkain, poor eating habit, and high salt intake can exacerbate heart conditions such as heart failure and chronic high blood pressure. So kung kumakain masyadong marami at during the holiday, maraming salt, no? It can also trigger some heart conditions. And then, of course, yung mga maraming namamatay, it's usually due to delayed treatment. So delay in seeking treatment during the holidays, kasi busy, mga kasama, gano'n, okay? Or mahirap pumila sa mga emergency room, gano'n, okay? So what are some tips to reduce the holiday heart syndrome? So it's expected to enjoy holidays with food, family, and fun, but just don't overdo it. So yan ang advice. Don't overdo it. Do everything in moderation, just as you would do during the rest of the year. Okay. Kung may konting sobra, no, because of the holidays, than usual, konti lang. Wag masyadong excessive. So don't binge drink. So don't drink too much alcohol. Then avoid too much caffeine, mga coffee, mga tea, no? Okay. So what's your salt intake? Importante rin yun. Then of course, have some exercise, no? Yung regular, not only on that New Year's Eve, but even before the New Year's Eve, dapat may konting exercise to maintain your healthy status. So everyone should be mindful of alcohol consumption and general overindulgence during the holidays, whether or not they have a pre-existing condition or a family history of a heart disease. So kahit na wala kang history ng Heart problem, walang family history, ingat pa rin. No? Because hindi natin malaman kung kailan, kung tatamaan kayo o hindi. No? So, just this is just a reminder, pagka mag-enjoy tayo during Christmas, during New Year's Eve, no, inuman, no, toasting, no, do this in moderation. Now, the other one, health danger, is the firecracker injuries. No? Everybody knows this. In the Philippines, December has been declared as Firecracker Injury Prevention Month since time immemorial. No? Every December, there is an anti-firecracker campaign to reduce injuries caused by the use of firecrackers and other pyrotechnic devices during the holiday season. Okay. So palagi ko, hindi natin may iwasan yan. May mga firecrackers na pasabog, no? Okay. So I'll just give you a brief note on my advocacy against unnecessary firecracker injuries. When I was a surgical resident in the Philippine General Hospital from 1976 to 1981, I had this gruesome experience of seeing and treating patients with firecracker injuries every year end, every December. No? Baka December 29 pa lang, meron na mga pupunta sa emergency room. No? Then, pagdating sa December 31, midnight, ayon, up to January 1, ang aming dumadagsa sa emergency room ng PGH noon. Puro sa mga sabog ang kamay, mga mata, tinatamaan din, no? Dami, no? So I always ask myself out of frustration, when will they ever learn? No? Kasi 76 to 1981, 5 years ako naka-expose doon every December to all these nakakadiri mga sugatan. No? In 2004, when I was the chairperson of the Department of Surgery in Hospital Maynila, because I know that even after my graduation, tuloy-tuloy pa rin ang problema, okay, I launched a campaign to prevent unnecessary firecracker injuries in the city of Manila. Kasi nasa Hospital Maynila ako, yun lang control ko, city of Manila. So I wrote a letter to Mayor Atienza requesting him to have an ordinance, okay, promulgated by the City of Manila Council banning the use of firecrackers by the public in the territory of City of Manila during every year celebration starting 2004. I thought of such kind of ordinance as the most effective way of reducing, if not totally eliminating, the incidence of firecracker-related injuries in the City of Manila. Because at this time, there is a Davao, as we all know, Davao was the first one who had the ordinance ban on firecrackers. At maganda yung results noon. No? Pero dito sa City of Manila, yung request ko was not, hindi napakinggan. No? So December 2010, ang ginawa ko na lang, I just put up a website. Mahirap yata palitan yung mga ganito. I just put up some website, advocacy, and wanted firecracker injuries just to maintain yung mga tinuturo ko against unnecessary firecracker. So the only thing that I can do now is just to keep on reminding people on the risk of firecracker injuries and appeal to them to avoid. So I'm doing it up to now, no? With this pep talk. Okay. Reminder na lang. Fortunately, as years go by, more cities have passed ordinances on firecracker ban. Example, aside from Davao, Zamboanga, Baguio, Muntinlupa, no, meron na, no, and other cities, no. So again, fortunately, in 2017, President Duterte issued an Executive Order 28 providing the regulation and control of the use of firecrackers and pyrotechnic devices. Nung presidente na siya, nag-issue ng Executive Order. Pero hindi siya law. No? So this Executive Order limits the use of firecrackers to community display. Parang ito yung mga firecrackers, yung mga dito sa nasa sky, no? So usually community display, no? So the Executive Order of President Duterte has significantly reduced the number of firecrackers injuries in the Philippines, but there are still casualties, not yet achieving zero incidents. No? Meron pa rin. No? Pero nabawasan na. So firecrackers and fireworks, no doubt, will be present in our midst because of tradition, because of the culture, because of the practice. So there will never be, they will never be completely eliminated, as they will continue to be used for celebrating milestones and occasion. But if we do this, okay lang, basta ingat lang. No? And it should be done by yung mga experts uh, in creating those beautiful fireworks. No? So to avoid unnecessary firecracker injuries, my recommendation is that firecrackers be sold to and used only by people trained and authorized to do the fireworks during special occasions and in safe places. And the rest of the citizenry should just watch. Ako, nanonood lang ako, and enjoy the fireworks in a safe place and be protected from firecracker injuries. So ito yung mga campaign against firecracker injuries, no? So ito yung mga dati-dati, yung mga DOH is presenting pictures para matapot yung mga tao, no? Yung mga sabog na kamay, no? Then putol ng kamay, ng mata, okay? Ito ano to? Nasunog at naoperahan, okay. So ang dire-recommend, okay, display na lang, firework display, okay, rather than doing the paputok yourself. No? So kung what to do when you have firecracker injuries, kung sakaling nabiktima kayo, or you have some relatives who get victims of firecracker injuries, what do you do? So first aid management will include wash, copiously, maraming tubig at sabon, na right away. So this is applicable to all parts of the body. Kahit saan, maligo kayo, and then kung nasa kamay lang, then wash it thoroughly with soap and water. Then control the profuse bleeding if present by applying pressure either by a clean hand or bandages. Okay? Huwag kayo matakot na gamitin ng kamay, no? Basta malinis lang yung kamay. Pag may dumudugo, i-pressure lang hanggang tumigil yung pagdudugo. No? Okay. And then, if firecracker injuries are severe, seek consultations with physicians right away. Usually, tatakbo na sa emergency room. So take pain medication, siyempre masakit yon, no? As needed, such as paracetamol, para sa kirot, pwede. Then NSAID, mas malakas, no? So you can take the example of NSAID will be mefenamic acid, no? And others, or ibuprofen, ganun din, no? Then antibiotics may be prescribed by physicians as indicated. Hindi lahat ng may mga firecracker injuries kailangan ng antibiotics, no? Okay. So, depende kung gaano ka-severe. So, prevention of burn injuries naman. So, four common causes of burn injuries will be smoke inhalation. So, usually pag during the New Year celebration, there's also a high risk for yung mga sunog, no? So avoid the steam. May mga four causes of burn injuries: smoke inhalation, thermal injuries, contact, electrical, and chemicals. No? So, but the focus of discussion here would be, we will discuss the burns caused by thermal contact, okay? Especially by fire, hot liquids, and then contact with hot surface. So we will not discuss chemicals, electrical instruments, and smoke inhalations. So prevention is basically avoidance of contact with fire, hot liquids, and hot surface. So be vigilant and mindful against this risk. So first aid management for burn, kung nasunugan, so we usually classify, wash din kamay, and then later on, you classify your burns into superficial partial thickness, and full thickness. Okay, kung superficial, usually parang first degree burn lang yon, no? Medyo minor lang siya. Pero kung partial, medyo delikado na, no? Full thickness, talagang delikado na kailangan dalhin sa ospital, no? Okay. So yung we classify skin burn based on the depth, gano'ng kalalim yung nasunog, no? Ito, this is an illustration. Ito yung portion of the skin. Yung tinatawag epidermis lang, then dermis, and then yung taba, adipose tissues, and muscle. Yung mga first, second degree, usually mababaw lang yan. First degree, usually dun sa dito, parang sunburn lang yan. No? Second degree, a little deeper. No? Pwede din dito, deep second degree. And then, fourth degree, yun, pati muscle, sunog na. No? Okay. Kumisan kasama yung bone. No? So, ito yung mga, ito, first degree ito. Pag may blisters na, we call that second degree. Second degree na yan. And then usually, kadalasan, pag gumaling yan, may scar formation na yun. Ito naman, third degree. Mas malalim ito. So how do you, we have to know how to calculate the, the, uh, aside from the depth, first degree, second degree, third degree, we have to know the percentage of burns. No? Kung ilan yung percentage of areas of the body is burned. Kasi yan magiging guide pagdala sa pasyente sa hospital. Kasi pag any patients greater than 15% total body surface na burns should receive fluid resuscitation. Usually kailangan ng hospitalization, mabigyan ng swero. No? Okay. So yung these are methods of calculations by the doctors. The rule of 9, 9, ito 9 sa kamay, front is 4.5, back is 4.5, no? Ganun dito sa kabila. Then dito sa front 18, the rule of 2 times 9, 18 sa back, 2 times 9, 18. And then ganun din sa paa, 18%, 18%, no? Okay. And then yung dito, 1% lang ito. Okay? The rest are the rule of 5, rule of 9. Now, kung hindi matandaan yung rule of 9, no, mahirap kung isang tandaan, you can use yung palm. Gamitin yung kamay ninyo. No? So, use the patient palm na yung kasi iba-ibang sizes ng palm natin. No? So, gamitin yung palm size ng pasyente. Then, tingnan ninyo kung ganong yung degree of burns, body surface. Yung palm ng pasyente, hindi kasama yung finger, okay? Hindi kasama yung wrist, ito lang, this is equivalent to 1%. If you have burn area that is equal to this 1%, then 1%. Kung 3 times this one, then you can say 3%. Ganon. So 15% may burn na yung dapat second degree. Ha? Yung first degree usually wala yun. No? Kung 15% of second degree, then kailangan ma-hospital na yung dapat dali na sa emergency room. Usually, pinapa-hospital na yun because kailangan ng fluid, mga swero-swero na. So, first aid management. Okay. Very simple but important reminder. Pag nasunugan, wash with soap. I-flash na lang with water muna. Okay? For 20 minutes. Flash it. Okay. Matagalan. No? Then you can include the soap. Okay. So, use and non-use of antibiotics just as a reminder. No? Kasi marami dyan, isang kibot lang, may antibiotics pag nasunugan. No? For first degree burn, antibiotics are not indicated. No? Parang sunburn lang yan, hindi ka na mag-antibiotics. No? Second degree burn, yung superficial yan, hindi kailangan din antibiotics kung mababaw lang. No? Example, mga blister, pwedeng hindi. No? Give antibiotics only when there are signs of infection. So, babantayan lang. No? Kung mayroon ng, let's say, may mga nana na, mga may fever, then that's time you give the antibiotics. Now, for the second degree deep na malalim, antibiotics are usually given. So these are samples of antibiotics that are given. So you have usually topical lang nilalagay, bacitracin, polysporin, neosporin, no? Okay. Ito over the counter, pwedeng bili, no? Pero ito yung mga more expensive drugs, no? Na topical antibiotics, no? Kailangan ng prescription ng doktor at mas mahal ito, no? So after that, the burn, pwede nyo i-bandage, especially if it's second degree, third degree, no, i-bandage after washing. No? Analgesics, yung para sa kirot, as needed lang. Pag tolerable pain, let's say first degree, 1% lang, 2%, hindi naman masyado masakit, hindi na kailangan. So don't take analgesics anymore. Pero kung di kaya, because of low pain threshold ng pasyente, ng tao, then you can take the oral analgesics. So kung extensive ang burn, that's the time the doctors will give you stronger analgesics like NSAID or narcotics, even narcotics. So just another reminder, don't apply ice, just flush it with soap and water kasi ice masira, maano rin yung mga tissue, yung mga cells dyan sa tabi-tabi. No? And then don't apply home remedy, ito yung kadalasan ginagamit ng mga tao, no? Oil, kahit na anong oil, kumisa may butter pa, may itlog pa, no? So hindi naman kailangan ito. No? Okay. Toothpaste, yan, madalas din nakikita ko yung mga naglalagay ng toothpaste. No? Then kung may blister, when you say blister, may konting tubig sa loob, sa yung umangat na balat, huwag niyo i-burst, just let it ruptured by itself. Kasi parang protection din yon eh. Yung may blister, yung balat, kahit na dead skin na yon, no? Number one, it will, parang dressing na rin yon. It will avoid infection. Number two, mas hindi masakit pag may blister. Pag pinaputok na ninyo, masakit na yung, yung burn. So I think that's my last slide. So summary and takeaway, I have discussed the following. I won't repeat them anymore, but just remember that the more common health dangers will be yung vehicular accidents, physical injuries, and usually related to intoxication, and then heart syndrome, heart attack, no? Okay? Usually, ano rin yon, alcohol din yung may factor doon. Saka yung mga pagkain na marami. And then firecrackers and burn injuries. So these are the four main or five if you want to divide firecrackers from burn injuries. Related naman kasi itong dalawa. If you want to divide them, mga lima na. Or you can add one more, yung mga pagkain that would cause gastroenteritis, dyspepsia, yung masakit ng tiyan, no? Ganun, overeating, ganun. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on New Year Eve's health dangers. Knowledge is power, it gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on New Year Eve's health dangers in your health management. So this ends my pep talk. I hope I have empowered you to have an essential understanding of New Year Eve's health dangers in your health management. So before we go to the question and answer portion, reminder, please take the Olete. Okay. The link has been placed in the chat box. 50 Olete certificates will entitle one mentee to a free voucher for a ROJoson tele or face-to-face consultation. And then feedback, please type in your feedback in the chat box during the open forum before we adjourn. So let's now have a group picture taking before we start the QA and interactions. Please turn on your video now. Okay, so Wala na? Wala nang hahabol sa picture? Si Laurier. Okay. One. Harap dito, Christy. One. Harap dito, Christy. Oh, sige, ayaw humarap dito. One, two, three. Okay. Okay, so the floor is now open for questions, comments, sharing of experiences, as well as consultations if you want. No? Okay. Kahit na hindi pa New Year's Eve. Okay. Any questions? From your experience, ano yung madadagdag ninyo aside from the five that I mentioned? Meron pa ba kayong idadagdag? Ang common health danger? Wala?
Ako ho, meron.
O sige, good. Maria, ano?
Yung ano, stray bullets, di ba ho?
Oo, stray bullet. Yeah, tama. Okay. I hope it's not very common now.
Oo, sana.
Sana, okay. Yeah, a stray bullet is also a health danger, no? So, how do you avoid stray bullet? Tago, basta stay home.
Nasa ilalim ng bubong.
Kumisan sabi na babalitaan ko, yung mga stray bullet, tumatagos sa bubong, sa yero.
Oo,
Kumisan,
totoo.
kumisan hindi ko ma-imagine yun eh. Pag semento, baka hindi na. Okay. So anyway, the best way to avoid that is to ask all the people not to fire their guns, di ba? So, pero especially, sino bang nagbabaril nun? Mga may baril, di ba? Like even policemen, mga ano. Pero pinagbabawal na yun, di ba?
Yes, Doc, pero usually, nakakainom din sila. Another one that I'm thinking of is
Oh,
fire.
yeah, fire.
Fire, fire. Alam niyo yung nasusunog na bahay dahil yung kwitis, dumiretso sa loob ng bahay. Those sort of
Oh, yeah,
things.
yeah, marami doon, no? So, pag nagkukwitis, dapat sa labas-labas na eh, di ba? Sa labas ng bahay, no?
Pero
Yeah,
Doc, accidents can happen. Kahit nga yung mga Roman candles,
yeah,
bigla na lang matutumba, those sort of things.
yeah, ganon. So, yeah, the best way is totally avoid firecrackers, di ba? That's the best guarantee, no? Hindi rin, hindi kasi baka yung kapitbahay mo nagpapaputok. Pero ginagawa ko dati, ganun. Pag may nagpapaputok, nanonood ako, pero binabantayan ko rin bahay ko.
Another is merong water. May
Y-
timba ng tubig or drum ng tubig.
Drum ng tubig para ready.
In, already. Kasi you can never be sure of accidents. Hindi ka nga nagpapaputok eh. Yung kapitbahay, magaling magpaputok.
Oo. Yeah. So be ready with water. Yeah. Ganun din. Yeah. I have done that before. No? Pag lalo na yung mga minipahat ka, may maliit na nipahat na baka pagbaba ng yung mga paputok sa sa sky, tapos pagbaba, no, masusunog yung nipa, no. Yeah, be ready with water also, no. Okay. Okay, any more? Sinong nagkaroon ng experience ng heart syndrome? Wala pa, kasi bata pa tayo lahat. Ako yata ang pinakamatanda rito. Meron pa bang mas bata sa akin? Mas matanda sa akin? Si Perla. Na-experience mo rin heart syndrome?
Man, doktor.
Ah? None. That's good. None. Okay. So,
Huminga. Yung smoke, doktor, ng mga fountain, mga ganun.
yung mga smoke, yeah.
Opo. Yung mga fountain, di ba, mausok.
Oo. Yung mga yung mga pyrotechnics, no? Okay, mga
Opo,
smoke.
mausok, doktor. Nakakaano.
Kainis, di ba? January 1, paggising mo, ang daming smoke, ang baho,
Puro usok.
pusok, no? Yeah. So I hope the community will just just need to control that, no? It will contribute to air pollution din, di ba? Air pollution, no? Smoke. Okay. So, sinong nagkaroon ng bad experience on the New Year Eve? Kahit na anong problema, in relation to health. Wala. Maswerte tayong lahat.
So far, wala naman.
Okay. Okay. Anyway, just take note of those health dangers, no, which are quite common. Ang unang, bagong in-introduce ko lang this year yung fat syndrome, no? Okay. In the past, di natin pinag-uusapan yan pero in other countries, madalas yan. Palagi ko, meron din tayo, no? Kasi the same mechanism kasi malakas uminom at malakas kumain during holidays, no? Once in a lifetime lang ito, New Year Eve, once in a year, no? Ganun, kakain, iinom, bahala na, no? So the consequence is marami, no? Usually heart attack, pancreatitis, yung mga ganon. Pancreatitis, masakit ang tiyan, no? Kasi dahil sa pagkain, no? So try to avoid them and then just tell your relatives and friends, no? Okay? Hinay-hinay lang sa lahat na gagawin, no? Okay? And then take the necessary precautions. Okay? No more? Wala na. Wala nang magko-comment, sharing, wala na. Wala na, we will, today is our last lecture pep talk for the year. No? We'll have a break, no? Christmas break, New Year's break, okay? So we will just resume January 6, no? That's the first Saturday of January, no? 6 na tayo mag-resume, no? Okay. So with that, Merry Christmas and a Happy New Year to all of you.
Thank you, Doc. Sa inyo rin.
Thank you, Doc. Merry
Merry
Christmas po.
Christmas to
Merry
everyone.
Christmas to everyone.
Merry Christmas, doktor. Merry Christmas.
Okay.
Merry
Christmas to
Christmas.
everyone.
Everyone.
Stay safe, ha? Stay safe tayo lahat.
See you,
Okay.
Thank
Doc.
you.
Blessed, New Year.
New Year. Blessed New Year. Okay. Okay. Thank you. Bye-bye.
Bye.
Bye-bye, Doc.
Bye,
Thank
Doc.
you. Thank you. Thank you for all your